Okay. I know you're kind of seeing part of my face here. I'm going to be pulling up the entire screen uh, and seeing to see what it looks like, you know, with you. But so today, um, what we'll be discussing is parenting children with special needs. Parenting children with special needs. And in case you're joining us for the first time, there are a few things I would like to do in the beginning. First, I like to um, kind of reintroduce us to whoever is watching out there. In case you're joining for the first time, this is Parenting Wisely. We're just a bunch of parents that together we try to help each other by through our discussions, counseling each other, feeding off of each other's experiences, and just trying to make the journey of parenting easier. I know that for a long time, it's almost like a no-no, a taboo for a parent to ask when they do not know what to do, and it almost as if you feel judged um, because everybody expects you to know, but it's not really true. Nobody has a manual to this, and this is what this forum is about. Principles are based on the Word of God. By now, you must know, you must have seen that, because we believe strongly in the Word of God. We believe in the principles of the Bible, and so at the end of the day, we anchor our thoughts and our principles on the Word of God. I like to issue a disclaimer. My name is Dr. Tolufa Fawora. Sorry if I didn't say that right off the top. I am a physician, but on this forum, I am just another parent. I am not trying to be a psychiatrist. I'm not trying to be a psychologist. I am not trying to replace any professional advice that you might have gotten, especially medically. I am just another parent learning alongside other parents through our experiences and these discussions. I like to tell people also, I like being transparent. Today, especially, I'm going to be sharing a few personal things because of the topic. It calls really close to home for me. All parents are expected to participate. I am especially calling out to you right now as you log on, as you join. Please, let's see you. I usually cannot see people when I'm presenting, but when you wave, you clap, you love, you ask questions, you comment, then I can see you. I like to acknowledge people when they come on. If I don't, it's probably because I don't see you or we're so deep in what we're talking about. But know that I love you all, know that I appreciate you all, and all the parents, that your comments, your thoughts, your advice, and your and sharing your experiences that are helping those parents also appreciate you. Um, so I guess at this point, um, we kind of get started. So you might be seeing half a screen of me, half a screen of my presentation today. That's because I want us to kind of follow together, see, you know, what I see and how we discuss, and maybe it might help you to think of stuff ahead of time, questions that you might want to ask. One more thing to add, all parents are welcome. Some parents wonder why this. And I always say, well, I was a single parent for the longest time, and well, still I'm a single parent, and I know the challenges I went through, and it was a passion for other, the thoughts about other single parents going through, that maybe going through what I had gone through, or what at the time what I was going through. I thought it would be helpful to let other parents know that one, they're not alone and they can do it. And yes, these things happen, and it's not peculiar to them. So it was that feeling, that thought, that passion that got Parenting Wisely started. However, even though it started with the thought of single parents in mind, all parents are welcome. And by the way, single parents are not limited to people that do not have spouses. Some people are raising their kids alone because of work of their spouse, because of other extenuating circumstances. So whether you're fostering, whether you're a single parent, whether you're a married parent, whatever kind of parenting style you're engaged in, or you are welcome. I want you to know that you are welcome. So with that, let's get started. So our topic today, I'm going to share this and then minimize the screen briefly. So special needs, parenting children with special needs. That's the topic for today. So children with special needs. What does that even mean? You know, what does special needs mean? Why do we use the word special needs? Well, the term is really a catch-all phrase for a variety of diagnoses and disabilities. It's not one thing. It's a myriad of things. And you know what? Even people with disabilities, they actually do not like now. I think some have opted to not use special needs, but actually use disabilities. And these are children that may have challenges that are more severe than the typical child. And some of these challenges could last a lifetime. You know, sometimes we take things for granted. For example, reading, a child that can read, but we have children that are dyslexic. And so they read a little slower. They actually get to be able to read a little slower. And sometimes you're thinking, for your age, for your grade, why are you not able to? And some parents get frustrated. They are angry. They talk harshly to these children because they don't know any better. Not because they're trying to be mean parents, but I want to believe it's because they do not know any better. Okay, so we're going to just that's essentially what special needs means. People with disabilities. Disabilities could be a lot of different things. We're going to get into that. Um, but when we say special needs, it's those kids that need a little more hands-on, a little more help. They are not as free flowing in their daily living, in everything that you expect a child to be able to do as other peers. Okay, so these children typically need extra support and they need additional, service with achieving, typical milestones, academic milestones, social milestones, emotional milestones, and medical milestones. They usually need extra help. They may need a lifetime guidance and support with, everyday things like housing, finances, employment, social involvement. They may need help with these things. And for some, it's a thing of a lifetime. For some, they can be helped to catch up, you know. But so, what are these types of disabilities? What are we even talking about? What makes up these people? Well, there are different types of disabilities. When we're talking about children with special needs, we're talking about different things at different times. For some, it's physical. I'm going to allow you to see this entire thing. For some children, it's physical. Examples of those can be children with muscular dystrophy, multiple sclerosis, chronic asthma. Can you imagine epilepsy? These are, you know, disabilities that are physical. I will go on a limb and say also sickle cell disease patient. These are all disabilities that can be physical. There are some that are developmental. That's the second type of disability. Developmental, children with Down syndrome, children with autism, children with dyslexia, processing disorders. These are all developmental. The third type of disability are the ones that we call behavioral or emotional. Children with attention deficit disorder or ADHD, attention deficit hyperactivity disorder. Children with bipolar, depression, anxiety, oppositional defiance disorder. These are all behavioral. And these are the children that we usually say, why can't he sit still? Or why is he so different? And sometimes some parents actually start to feel weird. They feel weird around their own children, especially when they take them to the park or to a party. And, they just think the behavior of the child is not normal, if that, that's the way they see it. But that's the third type of disability. Last but not the least, the fourth type is the sensory impaired. These are children that are blind or visually impaired in any ways, like when they say they are, um, um, they call it something. I'm drawing a blank here. Medically blind, no, there's something else they call it. Anyways, children that are deaf, or they have limited hearing. These are sensory impaired. It's also a type of disability. Now, what are the causes? I want to say causes and risk factors are actually, what are the causes of this? Sometimes we can really pinpoint the cause of what's going on. So we would say these are idiopathic. Sometimes we have congenital defects. They are born with it. Sometimes it could be genetic. Sickle cell disease, for example, is genetic. Cystic fibrosis, you know. Sometimes it could be genetic due to mutation, you know. Sometimes it's exposure of the parent, whether in pregnancy, to mutagens. Mutagens could include radiation. I remember there was a child that I knew actually when I was in medical school, and we lived together with his parents, so we all just loved the kid, very loving child. But he was physically disabled. He actually had some physical malformations, but we suspected that was because his father worked in the radiology department. And in Africa, yes, they protect. I mean, if you're working in the radiology department, you're supposed to protect yourself, but there's no telling when you have chronic exposure to radiation. So, exposure to mutagens, it could be drugs, it could be radiation, it could be a myriad of things that could cause the child being born with disabilities. Complications of diseases in pregnancy. Sometimes a pregnant woman gets infected, and there's certain infections that they are no-nos in pregnancy because they can affect the baby. They can affect the formation of the baby, especially in the early weeks, in the first 12 weeks. So that's another risk factor. And then medical malpractice, something like cerebral palsy. Sometimes that can be an effect of medical malpractice during childbirth. Or that's what a lot of people tend to believe. And there are other things, Bell's palsy, when you have the paralysis, and damage to a nerve. All these can be causes of disabilities in children. Okay, so what are the effects? What are the effects of these disabilities? Okay, I'm trying to really keep this super clean. So what are the effects of these disabilities? All right. Pardon me. This is me. I just mistakenly closed the page. As I was saying, what are the effects of disabilities on the child themselves? Well, what do we think? The child Sometimes we think they don't know much, but they do. They feel. Sometimes they feel like they're trapped in their unresponsive bodies. But let's take it one by one. The child may be born with a syndrome, which is a bunch of different signs and symptoms, all collectively as a result of one disease. So sometimes the child is born with a syndrome. Sometimes the child has a terminal illness. It just cannot be helped. Um, you know, I know multiple sclerosis, for example, people live with it for a very long time, but there is no cure. It just goes on. Um, uh, Sickle cell disease, we don't see it. A lot of, in fact, in the third world, it's unfortunate because people don't even know how grim of a disease it is because um, they, you know, the bulk of what they talk about is pain. And it's either you believe they're in pain or you don't. And somebody's as the pain of the person yet who says he or she's in pain is only as much as he or she says it is, also as much as you believe it to be sometimes. So, but these are diseases that, as mild as they look, they can actually cause death. Now, there are other diseases that are more grim, cystic fibrosis. Anyways, and the other effects it might have, cognitive impairment, sometimes mild, sometimes profound, mental retardation or mental incapacitation. You know, these kids suffer from these, and sometimes up to and including serious psychiatric problems. When you have anxiety disorders, sometimes you have depression, bipolar disease, even schizophrenia. You know, some of these children, they suffer from these things. Sometimes that's the bulk of the disability they have. Sometimes it's as a result of the disability that they have. Now, remember the topic is parenting children with special needs. So we needed to talk about what these special needs is, what we're looking at, you know. But what about the effect on the parent themselves? We are here to talk about parenting. We're here to talk about the art and the act of parenting and how different things impact us. So, talking about children with special needs, how do they affect the parents? How does their disability affect their parents? Well, this is where I say it calls really close to home. I was born with a child. I have a sister, or sisters actually, with special needs. And so I have seen firsthand. But I also dare to say my mom is actually not atypical because I have not seen a stronger person in the face of such a life challenge. Some of the things that parents with children with special needs can feel, or some of the effects on them includes anxiety. Sometimes they don't know what to do, or just finding out about it. Just waking up daily with this child that is not going away. Anxiety. Sometimes it's sadness. Doesn't it make sense? This is not, I have a headache and it's going away. This is a situation of a lifetime. Sometimes, stress. They cope and then they can't. They cope and then they can't. And it makes sense because it's a repetitive thing you're doing. You're trying to cope on a daily basis. No expiry date, no end date unless it ends. And it can also be the source of depression for these parents. It's hard when you see a child, maybe a 5-year old, who is supposed to be maybe helping you bring diapers and creating fun for their younger ones, and this is the child you are still trying to check if their diaper is wet, or they can't quite communicate well, or you just have to carry them constant medical visits, or hospital visits. It can be a lot. So there's nothing we're saying here that's really rocket science. You can it sometimes these children, the taking care of these children impacts the parents' life so much that little things that we've taken for granted, like I have a party this weekend, or I'm going to go to my girlfriend's house and we're going to go catch a movie. It's no longer the same with them, because every single time there has to be, who's going to take care of this kid? Who am I going to leave him or her with? Um, do I have the money to do it? Some countries, they, blessed enough that the government takes care of them. But do you also know that in these countries, and I'm talking from experience because, like I said, I have a sister with disabilities. And for a while, I was in charge of her care. So I know that it took much more than I can say on air for her to get the full benefits. And can you blame the government? There are quite a number of them. And in the country where they're taken care of, sometimes the resources are stretched thin. Sometimes, if they can have the responsibility with the family, the government wants to do it. So it's not automatic. But all I'm saying is, now imagine a parent who is full on 100% handling the child, where there are no benefits. I'm talking about other countries like Africa, parts of Asia, parts of Middle East. These are the effects it has on the parents. In the social gathering, especially in countries where they have they don't have the same empathy, they don't have the same understanding as some countries have. In such places, having a child with a special need is a dilemma. You're trying to protect yourself, you're trying to protect the child, now you're trying to take care of the child, and everybody looks at you funny. You're actually you it's almost a disgrace. How dare anybody think about a parent with a child with special needs in that light? Unfortunately, we still have that going on, which is another reason that I thought this topic was important enough for us to discuss. Because believe you me, there are still parents that don't even know what to do with it. Maybe because of their environment, maybe because of their social um, environment, maybe because of their status. I don't think any of this should have a bearing. But you know what? Some people just genuinely don't know what to do. They can't own it. Okay? Now, how do we then handle this? How do we handle this situation? So you have the child. There's nothing you can do. My sister is on a wheelchair. She wasn't always on a wheelchair. She walked, but right from the beginning, she had visual impairment, and her balance and her gait had always been funny. And gradually she lost that ability. And now I'm just being real. I'm just keeping it real. And I had to first then take care of her for a while. Now, how do you handle that? First of all, you have to be able to love your child. That child did not call for it. I said earlier on, we judge these children sometimes by their abilities. That's wrong. That is so wrong. You know why? A lot of them, they're way more intelligent than you can imagine. They see it, they hear it, they feel it. Because they can react like you and I, they don't have the same facial expressions, they don't have the same verbiage, they don't have the same command of language. It doesn't mean they don't understand. Some of them can't even talk at all. It still does not take away from their understanding from their feeling, their ability to love, their ability to feel pain. They have a lot in them they want to say. They have a lot in them they want to do. I tell you what, my sister will tell you exactly what she wants, where she wants to shop, what she wants to eat, if she wants to go on vacation. But if you're not listening, you ain't gonna hear her. Not because she can speak loud, but because she speaks with a drawl. And if you're those type of people, if you're the type of people that look once and judge, then you're gonna miss all that. She has a good sense of humor. Oh, by the way, she's feisty. Very. And one thing I noticed, and I'm using her as an example because that's the example I have, the real life example that I have. You know what I noticed? For you people that think your kids, your disabled children, they are angry or aggressive or they just don't have any social skills. Stop and look a little closer. What I found out about my sister, because her brain functions far above her body, she smells being taken advantage of from 100 miles away. And if she so much as thinks what you're saying or the way you're acting is trying to belittle her or take advantage of her, oh, you getting it. You are so getting it. Because she's going to get in your face. She will fight you tooth and nail and throw everything she's got at you. Why? She's trying to protect herself. Why will she need to protect herself? Because she understands. Because it's a battle between her mind and her body. So if you have a child like that cannot lift a hand, maybe even have malformed limbs, please don't ever talk down on them. Don't shove anything down their throat. These are the people you need to ask, what do you want? How do you want it? They have colors they like. They have the ways they want to dress. You need to know these things. So back to our list of what to do. Love them. They know more than you think they know. They're humans too. So if you know they're humans too, treat them as such. Don't